Government layoffs are unfolding more and more throughout the territory. Last week, dismissals were delivered to teachers and Department of Education employees. This week, layoffs have reached the Department of Health.
The termination letters that were served on 18 to 20 employees in the Department of Health in the two island districts over the last 2 days is part of the ongoing process by which the executive branch departments and agencies have been charged by the Budget Office to reduce their operating expenditures to remain in line with the available revenues.
The Department of Health directed News 2 to reach out to Government House for comments and inquiries on its layoffs. According to Government House, the Department of Health was not affected by the government's first round of layoffs in January, when about 500 workers were let go.
There were no employees in that wave of per diem, part-time, or temporary workers that were affected because the only employees in those three categories that are on the payroll of the Department of Health are emergency medical technicians, and they were exempt from the dismissals.
But in the government's second round of layoffs, the Department of Health is required to cut $1.4 million from its operating budget, which is why 18 to 20 of its employees were let go.
This is an ongoing process that has already taken place in many of the agencies and departments of the executive branch. I believe the Department of Health, the Department of Human Services, as well as the Department of Education were among the last of the larger agencies of the executive branch that recently experienced their dismissals. But it's an ongoing process. I believe the Budget Office has already sent out guidance to the departments and agency heads indicating in the next round what the reduction that has to be realized by the central government is and what their departments will have to contribute towards that aggregate number. I believe the number again is $20 million.
More budget cuts could mean more layoffs and reductions in services. Allison Bourne-Vanek, News 2.